Sex. There are many reasons ladies may not want to have sex. 8 strange allergies that are real. 4 out of every 10 children are allergic to pollen and dust, and many people are allergic to different kinds of food. So, being allergic is not unusual. But you may be surprised that there are people that are allergic to almost everything, from water to food to even money. Here are 8 strange allergies that are real. 8. Exercise. Exercise is good for the body, and doctors advise that you should do it regularly. But note that exercise is not for everybody. Some people get nausea, hives, abdominal pains, swollen lips and tongues, or difficulty in breathing just because they exercise. Exercise-induced allergy is not a common thing, and it could be triggered by food you eat or by cold. A 17-year-old boy in the UK has a history of having allergies in the winter. If he exercises in summer, he would be fine. Also, people with exercise-induced allergies may be okay if they eat a particular food without exercising, but they will develop an allergy if they exercise after eating the food. Experts believe the increase in the blood flow during exercise to the stomach is what causes the allergy. Whatever the reason may be, when you see people that are not doing any form of exercise, know that they may have good reasons. 7. Shoes. To many men, leather shoes are part of fashion, but to some, they are problems. You may be surprised that there are men who develop reactions when they put on a new pair of shoes. The reaction may range from itchy to pain, to redness to swelling of feet. This kind of allergy may develop a few hours after wearing a shoe or taking some days to wear the shoes before noticing the reaction. And if it leads to rashes, it may take up a week before it is cleared. Shoe allergies are caused by adhesives, chemicals, and substances used to treat leather. People suffering from shoe allergies can avoid letting their feet have contact with leather shoes. The best option, in that case, is the regular wearing of socks. 6. Money. Do you think anybody can be allergic to money? You don't have to be scared. We're not talking about the dollar bill here, but some people develop reactions to coins. If you touch coins and you develop rashes or itching, then you have nickel allergies. Nickel is among the components used in making coins. It is also used in jewelry, earrings, mobile phones, and frames of eyeglasses. Some people develop reactions when they touch any of these items. The reaction may begin a few hours after touching a nickel substance and may not start until days after touching it. Nickel allergy reaction may include itching, rash on the skin, redness of the skin, or draining fluid. The reaction might last for as long as 4 weeks. So, if you're allergic to nickel, must you avoid coins? Yes, if possible. But if you cannot avoid touching nickel, using hand gloves will help. 5. Sunlight. We all sunbathe and it is a pleasant experience. There are many benefits to exposing your skin to the sun. But you may be surprised that up to 1 in every 5 people develops reactions exposed to sunlight. The most common allergy to sunlight is called polymorphous light eruption, PMLE. It affects women more than men, and it may also run in the family. There is nothing to show that this skin problem affects people of particular skin color than another color, but age may affect it. In most cases, it starts at the beginning of adulthood, but it has also been reported in children. This reaction may also be triggered by other factors like medication or exposure to certain plants. The reaction to exposure to sunlight in people suffering from PMLE may range from pains, redness of the body, itching, and even bleeding. These reactions may clear without any treatment, but in some cases it may require treatment. There's a case that is even more severe than PMLE. It's called porphyria. Porphyria can lead to cramping, swelling, blisters, and even paralysis and psychosis. So, if you're allergic to sunlight, what should you do? Not much. The best way to protect yourself from sun radiation is by wearing sunscreen and protective clothing. 4. electricity. Even as many medical experts doubt the existence of reaction to electric current, there is a woman who could not have anything to do with electricity. She couldn't cook with an electric stove. She couldn't use an electric iron. Even she couldn't handle a cell phone, just because she is allergic to anything that works with an electrical circuit. This rare condition is called electromagnetic hypersensitivity, or simply EHS. It is caused by exposure to an electric or electromagnetic field. People suffering from this condition are usually unable to live in public places because they cannot withstand most of the everyday things that happen around us. Imagine a situation where it becomes a problem when you put on your TV or your neighbor picks up his cell phone. That's a terrible experience, right? A 45-year-old British man suffering from this kind of sensitivity had to relocate to a garden home without electricity and even running water. And he needs an assistant to do the shopping for him, as he cannot withstand the condition in the malls. Symptoms of this allergy may include nervous disorder as well as reactions in other body organs. 3. Sex. There are many reasons ladies may not want to have sex, but do you know that some want to, but are allergic to it? About 40,000 women in the United States suffer from seminal plasma hypersensitivity, a reaction that develops after unprotected sex. Of course, it occurs mostly in sexual active females, and it may affect only one part of the body or every part that has contact with the seminal fluid. It is possible for a lady to experience this condition with a particular sexual partner and not experience it with another sex partner. It is also possible to suddenly develop it with a long-time sexual partner. Symptoms may include pain, swelling, redness, itching, and a burning sensation in the affected body parts. So, if you are suffering from seminal plasma hypersensitivity, what should you do? Well, we can't tell you not to have sex. Experts say, use protection. But what if you're trying to conceive? Such a situation may be frustrating, but you must weigh your options. The symptoms usually start about 10 to 30 minutes after sex and may last for a few hours or a few days. If you can bear it, then go ahead. But if not, you still have more options. Assisted reproductive techniques can help you out. You must talk with a fertility doctor who will explain the best procedure for you. But the good news is that it's a rare case. 2. Water. Water may be essential to all human beings, but do you know that there are some people whose skin cannot withstand moisture? It's called aquagenic urticaria, and it is believed to be affecting some 32 people around the world. Rachel Warwick is one of them. Rachel watches others as they swim joyfully in the pool. She watches kids as they play in the rain. But to have a drop of water on her skin is hell, not even her sweat. It will lead to itching, pain, and swelling. Her symptoms may persist for a few hours. To minimize exposure to water, Rachel showers once a week, and she drinks more milk than water. She wears clothes that will not make her sweat, and avoid washing dishes and doing laundry. That's the best anybody could do. But despite all these, she couldn't avoid water altogether, and Rachel is not alone in the situation. There are over 30 other people like her. 1. Food. If being allergic to water is bad, then what will you say about food? Yes, many people are allergic to different kinds of food, but some are allergic to all types of food. They can't eat without developing reactions. This condition is called eosinophilic gastrointestinal disorder, or EGID. People suffering from this allergy develop inflammation in some parts of the digestive system when they eat food. It could lead to vomiting, diarrhea, stomach pain, and even more severe cases, ulcer or anemia. It usually starts by being allergic to some food, and then the list will keep increasing until you become allergic to all kinds of food. Then you may ask, how do they survive? EGID is a life-threatening disorder. Some patients suffering from this allergy had to have food passed on to their bodies from time to time. This reaction affects people of all ages, but it could be more controlled if discovered early. EGID might not be as common as many other allergies, but it affects 1 in every 1,000 people. That can't be said to be rare. Of course, it is as common as the number of people suffering from sickle cell anemia.